first of all, I want to say thank you, Doc, that you explained what the aromatase inhibitors do better than anyone I've ever heard. And I understood it,
Yeah.
but I have to dumb it down when I try to explain it to people, and you were very clear. So thank you for that, because I think that's going to help a lot of people understand the
Yes.
difference, right? You are absolutely 100% on that. It exemplified all my side effects of menopause. I had more hot flashes. I mean, I was a mess, but I got through it. I took turmeric. I did, I had a cold washcloth by my bedside. So, I mean, you figure things out, right? Because it is temporary. Once I went off it, so it's been a year since I've been off the aromatase inhibitor, my hot flashes are almost gone. I'll get one maybe every few nights at 2 a.m. And there, other than that, I'm good. My brain fog, I'm a lot clearer. I can speak clear. I can find my words, and my joint pain is much better. And sexual side effects were rough for my husband and I, and that has cleared up. Everything's cleared up, and I feel almost normal. It's a new normal. It is. I still have anxiety of recurrence or other cancers, but I have a lot of cancer in my family, so I knew what I needed to do. I feel a lot better, 100% better. So yes, thanks for asking, CJ.
Yeah, it's important people hear this, right? I mean, it
Yeah,
really is. And
yeah.
Dr. Audi, I can't remember the question I had. I wrapped
Well,
up two.
I remember, but I'm very happy to hear that many of those side effects diminish, which is really what typically happens. The side effects of aromatase inhibitors, can start as soon as 6 weeks after starting. They usually peak around 6 months, but for most women that I cared for, if they stuck with it, they usually started to diminish after some time. Not
Oh,
for everyone, but for some it did. So my guidance was always, all right, well, the first 6 months are going to be the toughest because that's when you're going to feel the real change. And then let's just see how long we can ride it out and see if it gets better. And in the meantime, we'll do everything we can to mitigate the side effects. And as you mentioned, you found all kinds of solutions for the side effects. I think the joint pains are, I think, the most severe things that cause people to want to stop these drugs. And while I can't say that any one of these remedies always works, I find that for many women it did help. Certainly, we recommend exercise just to
Yes.
keep the joints moving, just as with any type of arthritis. Acupuncture has been proven actually to help,
wow.
specifically this kind of side effect. For all of the different uses of acupuncture, this is one that actually has medical evidence behind it that it can work.
Mm.
Um, Non-steroidal anti-inflammatories, ibuprofen, those sorts of drugs can help somewhat, just like with any arthritis. And then there's even a drug called Cymbalta or duloxetine. It's actually an antidepressant drug, but it actually does seem to help some of the side effects of aromatase inhibitors. And again, that's been proven in
Wow.
clinical trials. You don't want to turn to a prescription drug to solve the side effects of another prescription drug unless you absolutely have to. But
Mhm.
that's been tested. Omega-3 fatty acids, anti-inflammatory herbs, things like turmeric, all of these things have been looked at and may help to some extent. So for a woman who's motivated to try to stay on an aromatase inhibitor and deal with these, there's a list of things that I always tried, and we worked through all of them. There's three main aromatase inhibitors, as you probably know, letrozole and anastrozole are chemically pretty similar. Their side effects are pretty much the same. And then there's a third drug called exemestane, which is another aromatase inhibitor that is chemically built a little differently. So normally, if someone was having trouble with letrozole or anastrozole, I would try switching them to exemestane because it was simply handled by the body differently. And in some cases, it seemed to help with the side effects, and in others, it didn't. But ultimately, all three of them pretty much do the same thing, cause the same sorts of side effects, and provide the same level of protection.
Wow, this is so helpful. I know we're short on time here, Dr. Audeh. Any closing thoughts? Because this, I hope, will be seen globally to help women all over the world. This disease is on the rise. It's incredibly unfortunate what I see every single day. And I see the comments, I see the questions. There's not even enough time to cover the amount of questions that I have. But any, both of you, encouraging thoughts, Dr. Audeh, first?
Yes, of course. I think aromatase inhibitors wouldn't be the standard of care for anti-estrogen therapy for postmenopausal women if they hadn't been proven to reduce the risk of recurrence in a very major way. They are really incredibly powerful and helpful drugs. But of course, as with any such treatment, they carry significant side effects. And I would say that it's something that can get better over time for many women. And you really have to draw on all the resources you've got, not just the few minutes you may have with your doctor, but resources such as this type of website, information that's out in the media. Wherever you can get information, I think the better informed you are, the better you'll be able to handle this kind of challenge.
And I just want to say, Dr. Audeh is a medical advisor for Learn, Look, Locate. And having you be part of this mission was my biggest wish. We need more time with the medical community. So I can't thank you enough. And Kelly,
Mhm.
closing
Yes,
thoughts?
I would just say remember to have that relationship. I do have an amazing relationship with my medical oncologist and my physician's assistant in the cancer center, and to have those open conversations. Don't be afraid to ask them questions and include your pharmacist because they're the experts on multiple medications, right? And I think that they can be your cheerleader. So between the two of them, make sure that you have that relationship. A
Mm.
second opinion is a second opinion for you to make sure that you feel comfortable with that medical oncologist. It's really, really, really important. And a great medical oncologist is going to welcome second opinions.
Mm.
So when you have that relationship, those open conversations, you can be successful. You can get through it. For those women out there that are taking these drugs, you can get through it. Just keep at it. And I would say make a goal for yourself. Okay, I'm going to get to that 6 month mark and see where I'm at and celebrate those milestones. I think that's really important for
Yeah.
patients.
Yeah.
It's not going to be easy. You're not going to have great days all the time. You're not going to have bad days all the time, but you can get through it.
That's awesome. Thank you
Yeah.
so much, both of you. I'm so honored for your time today. So I hope this helps a lot of people.